It is estimated that approximately 2.7 million children between the ages of 0 to 17 years could be living in the institutional care worldwide. Article 27 of the United Nations Convention on the Rights of the Child affords every child in the right to a standard of living adequate for the child's physical, mental, spiritual, moral, and social development, and requires that parents or those responsible for the child secure within their abilities and financial capabilities the conditions of living necessary for the child's development. However, there are many conditions under which parents might find themselves to fulfill their obligations, rendering their children without proper parental care and protection. In such situations, parents may decide they are either unable or unwilling to provide basic needs. Such situations can result from a number of wide-ranging stresses, including poverty, health issues, stigma, substance abuse, death, household or community violence, and many more. Article 20 of the CRC stipulates that state parties are responsible for ensuring such care. Institutions where children are temporarily or permanently deprived of his or her family environment. Children exposed to institutional care often suffer from structural neglect, which may include minimum physical resources, unfavorable and unstable staffing patterns, and social emotionally inadequate caregiver-child interactions. The wide recognition of the adverse impacts of institutionalization on development outcomes and children well-being has led many countries to undertake efforts to reduce the numbers of children living in alternative care to prevent institutionalization in the first place or to reunite children with their families.
I'm Eddie Joshua Walakira. I work with Makerere University. Social work is not so easy to define, but it's a profession, first of all. You must be knowledgeable about how to relate with the people, to understand how to understand their problems, and how to address their concerns. We play many roles at different levels. At a personal level, you must be able to professionally deliver expertise that touches the individual to get them out of a situation that is undesirable to a situation that is desirable. So social work is very much associated with empowerment of individuals. It's also about fighting for the rights of individuals and improving their welfare, their well-being, fighting for the rights of the marginalized, the children, the women, persons with disabilities, those who are aging, individuals or communities that are displaced due to war, those that suffer, those communities also that suffer what you can call collective trauma due to mass rights violations or any other adversity. So social work is an embodiment of many attributes that a professional has to bring to the fore and to help individuals out of difficult situations. We play different roles at the national level. We have to influence structures, to change policies, and to ensure that those who are not well off can be included in the programs that are put in place. You have to advocate for better funding, especially for children and young people who don't have employment, and many other categories of individuals. So that is how I understand social work.
From the paper that I did, I found out that most social workers have they don't have information on policies that are existing to actually do child protection on children. most people don't know about adoption. They are practicing social workers, and yet they don't know about foster care. I mean, they are not aware. And even those children officers who are supposed to implement it, they lack. I guess they lack training, and I don't know whether it's the will or the sensitization, because they are also supposed to sensitize the public about foster care so that people are able to appreciate the service and take it up. So those are some of the things that came out here. And then monitoring on the children, it's a challenge for social workers in Kenya. But I guess if they are empowered more on training, they are able to do it. We are able to do it just like Rwanda has done. Rwanda has done very good in institutionalizing children.
So my name is Anna Jolly. I'm a project manager with Child's Eye Foundation in Uganda. So Child's Eye Foundation, our mission and vision is to see a Uganda free of orphanages and to see all children growing up in safe and loving families. The project that I manage specifically for Child's Eye Foundation is called Keeping Children in Healthy and Protective Families. So we're a 3-year operational research project operating in 9 districts of the central region of Uganda, partnering with childcare institutions, orphanages, to reintegrate children back to their families. So at the moment we're about 1 year into implementation, and we have the project is a consortium. So we are one partner, we're managing the case management component. We also have Transcultural Psychosocial Organisation of Uganda, TPO Uganda, who manage a parenting component, and then we have Makerere University. So the overall research question is to evaluate whether the inclusion of a structured home-based parenting program alongside household economic strengthening and case management, if it improves reintegration outcomes. So we'll complete the research at the end of 2019. And we're hoping that the paper can then be used to influence policy and programming globally, really.
So you say you're 1 year on, and I'm sure in that 1 year there's some lessons that you have learned, and there's some things that you have seen in your program that you'd really want people to learn from, as some other countries, like for example Kenya and Tanzania, as they start this journey of de-institutionalization.
I think the big one for us, and this is a learning that's also been, I think, very well spoken about here in Rwanda at this conference, is that the movement needs to be government-led. The policy is there in Uganda, the legal framework is there, but it seems somehow that it's just not trickled down to the grassroots yet. So I would say that our biggest learning is around that sensitization. You actually asked a very good question in the previous session, that, you know, how do we position ourselves so that we're not seen as being against child welfare, because people have been looking at institutional care for a very long time as the dominant model of care. So it's not easy to come in with this concept that it seems very novel to people, that children belong in families. It's hard for us to understand, but I think the learning is that the policy's there, government needs to be sensitising on these policies. Any initiative towards DI reintegration needs to be government-led. For us as well in year 1, the big learning, which is something that I presented on at the conference on Tuesday actually, was around partnership building. So not just looking at the institutions as, you know, a barrier to be pushed out of the way, but recognizing the agency and the strength of these institutions as well. Seeing them as valuable partners, bringing them alongside, recognizing that they know these children best. It's in the children's best interest to work with them, to cooperate. So I think for us in year 1, we've really put a strong focus on building those partnerships, and I hope that we can continue doing that throughout the lifespan of the project. It's an interesting dynamic, definitely, because we do often find ourselves in the middle. I think it again comes back to sensitization, and it's the importance of having the institution working alongside you. The organization and yourselves need to understand that you're working towards a common goal, and your work isn't in conflict with each other. I think where social services are sort of presenting a united front, and also that there's, you know, a promise for ongoing support that the family needs, it's much, much easier.
Rwanda is known for many things, many progressive things, but one thing in the children's sector is known for is de-institutionalization. De-institutionalization is the process of removing children from institutions into family-based care. And one of the leaders in this process is Hope and Homes. And today on set we have Innocent, who is a country representative of Hope and Homes in Rwanda, and they have been successful to close up to 80% of children's homes in Rwanda.
I'm called Innocent Habimfura. I'm the country director for Hope and Homes for Children, and I'm leading the regional as a regional operation director for East and Southern Africa, trying to bring out the learning from Hope and Homes for Children Rwanda to other African countries. We are known as an organization that is leading in closing institutions, and our mission is to be the global catalyst for global elimination of institutional care. That is what we try to do here in Rwanda, and that is what we are trying to do for our other sister countries from the region. So institutionalization of children is already a denial of their basic right, including if we talk about child neglect. You can't think about a child fulfilling his right to family attachment, to one-to-one attachment, for example, in an institution. Why? Because one caregiver, the ratio of one caregiver will be like to look after 10 children. Do you imagine one person taking care of 10 children? It becomes routine. Uniqueness of children are obviously denied. It is not the bad willing or the bad faith of institution caregivers or owners. It is that understanding. But when did it come in our region or in our communities? In Rwanda, the first one was established in 1954. Do you know the reason? They themselves, they believe it was not the right thing. They say it was, let's have like a nutritional center where children up to the year of 3 years could come and get support from our centers, and at the end they will return in their families. What happened later? They enter, they never exit. I will talk again about the right to family, which is denied. We know that actually the UNCRC, the UN guidelines on alternative care, say that you can use those facilities as last resort. Do you know what happens? When parents die, it is the immediate, because it is quick and easy solution. The following day, write a letter and negotiate if a child can go. What happens with those children? Are they breastfed? Maybe yes. Maybe yes, but for our experience, they are not breastfed. They use powder milk. What if that powder milk is given to the living parent? What if the powder milk is given to extended family members? What if the powder milk is given to a foster care, a godparent? So in a way, we are using it as the first resort because we agree. We are misled by the existence. Through our experience here in Rwanda, we found that districts without institutions, without orphanages, are less vulnerable to placing children in those orphanages. So it's like a new school, a new education. And most of the support are coming from where? They are coming from I would say the Western countries. While it's a new policy, you can't even enter pursue to become a member of the European Union if you don't have a plan to deinstitutionalize. But when it comes on our side, we are encouraged to build them. So we need to look inside. We need to look at our approaches. We need to rediscuss. If it happened to Rwanda with its very traumatic experience, it can happen to another country.
I know the president of Rwanda is very supportive to this program. So what are some of the measures that the Rwandan government has put in place to ensure that this actually becomes a permanent thing and not just a fad?
I will first salute my president. I will salute him because I will say he's the really champion, pioneer of all the changes we are having in the countries, which are contributing again to improving family well-being. You know, among the underlying factors of child separation is poverty, and there are several initiatives around tackling poverty in this country. There is also the policy. There are many policies, I would say, many policies that are supporting children to remain in their families, including even laws. The Constitution of Rwanda is clear. We have law number 54 of 2011. We have the law on person and family that really have provisions around sustaining ensuring that children are raised in families, not in institutions. And his position is clear, because there are sometimes there is demarcation of what is in law and the real political will. The vision is clear. The vision from our leader is very clear, and rather than having a vulnerable, describing our children as vulnerable, we want them to be in resilient families, and for them as well to be resilient. We have one motto, again coming from our president: we need the dignity of our people. And I'm not thinking a child who is described the whole life as an orphan as being dignified. But a child who is in a family, it's just simple to say, I live with a certain family. Immediately people will say, wow. But when you say, I'm coming from a certain home, either good or bad, equipped or not, everyone will be saying, so this is an orphan. So I will say that the whole vision is very clear, and there is no disparities in speeches. The First Lady as well is really supportive of this program. She has been involved even in building some houses for young people who had to leave one orphanage. So in a way, I will say that the environment is really supportive, and that's why we can find significant change. What about sustainability? With sustainability, the government established what we call Inshuti z'umuryango, friends of family, and they are in thousands. For each village, 2 people, a woman and a man, who can identify families with issues, when families at risk of separation. They can provide support. If they don't have enough support, they refer, or the case is somehow complicated, they refer them to case managers. Case managers are social workers, again recruited by the government. So in a way, you find that all ingredients to have Rwanda as the first African country to be free from orphanage is really built from the government political will, but also it's really establishment of institutions like the National Commission for Children, and the clear shift from the tolerance, because the government didn't establish one orphanage, the tolerance of spontaneous establishment of orphanages. Now it is shifting to not being tolerant of, because it's a child right abuse, as I said. So in a way, the political environment is nurturing to have Rwanda deserve the position to be the first country to be free of institution and inspire the region. Yeah, I'm not good in mathematics, but our survey found that to care for a child in an institution, the cost was $140 per month. What does it mean? What if we count it for 10 years? Because we found that the average time of staying in an orphanage, an institution, this was between 10 years and 25 years. Can we count? What does it mean? What if we consider the $145 per month? We support it with a family which is struggling with vulnerability. With our experience again, you find that within a period of 3 years for the entire family, the family will become functional again, and children will escape for being separated with their families. Actually, the child is not doing well just because you pumped that money in the orphanage system. We found the malnutrition. We said again, it has a long-lasting effect on children. So this money is not really properly invested. I wish this money is translated or is reallocated to support transforming the former residential centers into community-based services like ECD centers, to serve the entire community, to support as recreational center, to serve as resource center for the entire community, and make sure families become functional, are not double punished by being poor and then being punished by being separated from their own children. I call upon every good heart, big heart, oriented in supporting children in orphanages to re-question the way they are doing it. They can still use their resources and impact in a better way our families, our communities in Africa.
Hello everyone. In this learning process of what DI is, we have the pleasure of having a child, now an adult, who has gone through the institutionalized care and was rescued from institutions and went through a home or family-based care. And he has an amazing story he has for us. So Eric is a successful case study of someone who has gone through the institution and transitioned to family-based care and is working, has a job in the bank, and he can tell us more about himself.
By names, I'm Kubwimana Eric. I'm 25 years old. My nationality is Rwandan. I was born in a place called Rutsiro in sector Mukura, but I joined the orphanage, Orphanages, when I was too young. I was a baby of 7 months, and after my mother died and I was the last born in my family, I was born with 2 sisters. Then later they all died in genocide against Tutsi in 1994. I grew up in the Orphanages in institutional care for children all my years. Like I left in 2014, yet I came in 92. I've been there, so that's my life. My experience living in institutional care for children. On basic needs, I never lacked things. I was able to study. I was able to access medical care. I was able to access food. But on emotional control, emotional needs, it was a hard experience because naturally we were raised as many children in one room, having guardians who could take care for us, but there was this sense of thinking, I'm still an orphan. And I grew up, I was so careless, I was so messed up. I never loved education, and I was performing poorly in my classes. And from those years, I mean from when I was 5 years old to 15 years old, I was I did not have an identity. So my experience first with Noel, with Orphanage, regardless of yes, I was able to get basic needs, but my emotions, my feelings were still lacking something. And I took Orphanage as my home, as a place I will grow up. I never knew where to go after. I knew as my home that I will grow up there. I will spend all my life there. And I have many children who were friends with me. We could we could play, we could joke, but nobody knew his destiny or his future. So we never paid attention of our personal life, our future, our responsibilities, because you sleep, eat, nothing more. It has affected me because till now I'm fighting to have identity, to feel I'm an important person, to feel I'm a man, I have also responsibilities, to feel I can also have a family. In fact, even still today, yes, I'm grown up now, I live independently on my own, but still I feel before I got married, I need to spend 1 year in somebody's family, which is composed with mother and the father and the children, so that I'm sure what family is all about, and how do I learn from this family and apply those principles in my future family I'm planning to build. Of course, I'm excited to have a family. I'm not afraid, but what I know is I just still feel, despite being 25 years old, I now feel to belong in a family. I feel this, I don't regard that I'm old enough to go and start mine, but I still feel that in me. I need to be in a family. And to be in a family, spend time there, learn how do they live, how do they act when they disagree, what are responsibilities of mother and the father in the family, what are responsibilities of the children in the family. Because when I grew up, there was no particular responsibility assigned to a child. So then there is no accountability, because nobody's going to ask you, why didn't you do this? So all this has challenged me when I come out in the community and it's how people lived. It was like an experiment. It was like discovering. I saw many things I never knew. In fact, it took me time to comply. It took me time to get used to the people, how they live outside here. So I still think if I am to make it in my own family, I need, despite being old, to be in a family of a mother and the father and the children at least 1 year. And I have to do that.
A parting shot on reintegration and institution care and family-based care.
I think there is now evidence to suggest that actually bringing up children in residential care institutions has negative outcomes on their well-being. It affects them mentally, physically, and psychologically. And because of the growing evidence, a lot of researchers and policymakers and academics are proposing the alternative, which is deinstitutionalization. Now, deinstitutionalization essentially means that you get children outside of the children who are being brought up within a child care institution, and you take them back to the communities. Primarily, you offer them what we call home-based care. Care by the mother, if the mother is around, and care by the father within the same family. And if the biological parents are not available, then you get the nearest of kinship care. And if they are not available, you can also do what we call foster care. You can find foster parents, you know, going through all of the legal processes and the necessary mechanisms that are necessary. At some other points, you can also do adoption. So deinstitutionalization, essentially, when you take children away, you will have options where you want the child to grow up from. I think I may not have so many examples, but I think it is now the responsibility of social workers, especially who are working upstream, who are in the policy-making domain, to have programs in place that foster and strengthen the functioning of the family and the functioning of the community. And any support that is geared towards these collective interventions can be very, very successful. There are quite many examples where communities have successfully worked on water systems in communities, and it is working. Where families are working together to improve agriculture, as communities, as individuals. Where women are working in groups, village savings and loans associations to save and to do business collectively and to meet their welfare needs. And these examples are there, they are working. And some of them are working because the government has created a favorable environment in the case of Uganda. So these same interventions, you can incorporate issues of child protection, issues of women empowerment, issues of collective welfare, and they can work. You build on these collective efforts within the communities and know how best can this work out if we provide this form of support. The problem is that we don't have structures at the grassroots that the government uses that can support these initiatives very strongly. But some of the evidence we have is that, for example, village savings and loans associations are turning around the livelihoods of communities, empowering them to participate in agriculture, small trade, and even, to go into simple manufacturing or starting up cottage industries. So it can work. Yeah, there is one example of a project that I know. It was called Early Steps Program, implemented by Private Sector Foundation, Health Child Uganda, Sedovip, and Makerere University. This program built on these collective interventions, and the outcomes have been incredible on the well-being of the family, of the child, and of the entire community. The same can also be used in fighting adversities or challenges like violence, domestic violence. The same can be used to restore the environment, and social work has a role to play. The same can be used to practice social work within the school system. Kenya, you may be better placed because you support children to have food within the schools. But in the context of our country, where food is not provided, these are some of the things you need to think about.
I think basically that for me, it's a big piece on stakeholder engagement. We need to get more people on board. We need to build more awareness of this issue. It's still quite niche. A lot of people, even working in child protection, don't fully understand alternative care or deinstitutionalization. So I would say keep talking about it. Keep doing this sort of thing. Let's bring some more awareness to it, work together and bring all of the stakeholders together that need to be involved, because you can't do it alone.
It's a request from a social worker who know that institutional care has really very bad effect on children, and I would say even long-lasting effect. And I call upon those who are still believe it's a solution for children to rethink their good heart, their good willing, because it has been demonstrated that with a very little time after returning in a family, the impact was visible that denying children the right to live in a family is not just a child right denial, but it affects their life. It's a matter of time. We may be calling it in a very diplomatic way, but as a society, we need to apologize. We need to apologize by setting these institution homes. Yes, maybe we did it with our empathy, but I will let you know that this is not the right way of doing. I'm calling you to really learn about how you can transition all those children back in families and ensure children are supported in their families rather than isolated in those settings. Children need families, and we believe that one day orphanages will be unacceptable.
We as a community, we have a responsibility to take care of our children. The institutions are not the best for children to grow because it affects their growth and development. So every other person should just be proactive in childcare and protection, and maybe we see how we are going to do this to get those children that are in registered and unregistered homes countrywide.